We started with the questions, and I'm just going to take them until the cows go home. And I know you. I told you to make sure you're inside and ask the first
And I
question.
promised that I would. Do you have a...
Yes. Who's got the microphones right up here? We'll hold them for you. And
Yes, Congressman. Last year, we were at your district office, and we warned you that by bailing out Wall Street and banks from Europe and in London, we warned you now to the tune of something upwards of $30 trillion. We warned you that we would get these kinds of crises on our hands. We also told you, why don't you get rid of HMOs, go back to a Hill-Burton Standard, which was legislation history that you should well be familiar with, and why are you supporting, you say, oh, even for our pocketbooks. I think that's the first thing that is on the mind of yourself and others in Congress. And you've got it backwards, sir. Respectfully, you've got it backwards. It has got to be the life of American citizens that is foremost in your mind. And I don't trust anything that those Ezekiel brothers, who, Ezekiel, Emanuel, that anything that they would write, especially when they've written, Ezekiel Emanuel has written that anyone with dementia should be denied health care. So, and he's written this, you can read it for yourself, go to the Lancet magazine published this year. The question is, why are you supporting this legislation? Why are you supporting this?
Let her speak.
got it.
Yes, let me speak, because we warned you. You knew that we were headed. We were the citizens in your district that told you that.
Okay, is that the question?
Okay. Thank you. It's good to see you again. And I mean that. All right. We've had.
Yes, a few times
And there's two major questions in there. Actually, three I'll address. First off, let me address the issue on. I think it's obviously right that this health care reform bill goes through. But I want to talk about the economic issue first, since that was a major part of the question. Right now, today, according to the Institute of Medicine, nonpartisan, we lose somewhere between $60 and $140 billion. So on average, about $100 billion in lost economic productivity because of the uninsured. That way, because they tend to be, when they get ill, acutely ill, that additional loss actually harms our economic productivity. Now, 10 times 100 is about $1 trillion. Number two, according to a RAND study, because of the less healthy overall, because remember, in addition to the 46 uninsured, there's 26 million underinsured, and there's 82 million who lose their health insurance for 1 or 2 months each year. When you wrap that all together, the cost per year to our economic productivity, as we try to compete with China, is about $260 billion a year. So I also know that according to these studies, and again, I try to look at the various studies, is that we all pay for the uninsured, if you're an individual, about $400 more than if there were no uninsured. If it's a family of 4, it's about $1,100 is your health care cost. Why? Because the uninsured will go into the emergency room, get taken care of. The hospital doesn't eat. they pass it on as overhead to the insurance companies that pass it on to us who still have private health care plans. So the concept of this plan was, if you got a private health care plan, we want you to keep it. Not become one of the 14,000 that lose it every day. Keep it. But the idea is we want you not to pay any co-pays anymore for preventive care. If you're a woman and you come in at 40 years old, there's a reason behind it, is if you're a woman, we know statistically, if you're mammogram, if we catch your breast cancer early, 98% of women survive. That's one reason we want people living on the edge not to say, geez, I'm not going to go in for mammogram this year. Well, it's free. Why? Two reasons. One, better quality of life. You can catch it early. And maybe even life. Second, we pay less before it spreads. And the cost attendant to recovering her quality of life is so much more enormous. So without going, and I'm going to go into more specifics as the discussion goes on, the concept was to begin to get people to be more healthy at less cost by preventive care so that we all can have more economic productivity. Now, the second question is very good too, is in this bill, and I know there's been a lot out there about it. I have read it. And I have a copy right here. And I read it, and I'll tell you why. Because this is the reason I got into Congress, to pay back. So this is what it actually does say. Having two parents in their 80s, I'm empathetic to this. Now, they're fortunate they have 8 kids. But when you get to your 60s, what it says that if a doctor and their patient decide to sit down voluntarily and discuss a living will, that particularly if the person is living by themselves, what happens if they're in an accident and who do they want to make the decisions? That's what it says, so that the doctor gets reimbursed for the time. It doesn't mandate anything else. It doesn't even mandate that. It's just saying, much like you come in to get your broken leg fixed, it says the doctor does sit down and discuss. And it lays out, by the way, there's about 20-some states that already have that as a volunteer thing to do. And I can get you the exact number that I have it. So all it does is says that now Medicare will permit you to get reimbursed for your doctors. Because, look, I have the first bill in 17 years, and I was discussing this once with you, on elder abuse. Pennsylvania between 2005 and 2006 had an increase in elder abuse of about 35%. Not just physical. Because I did have someone in my district with Alzheimer's who was beat 6 times with a belt, which is why I did this bill. But also mental, and also financial. So what you want is before they're abused, maybe they want to have a living will, and that's all it is. If it's all right, I'm going to circle back to you later on in the discussion.
You didn't answer my question. You didn't answer my question.
Which one was it?
Well, I said, we warned you of what would happen.
Question.
That's okay, let her finish, please.
I said
quickly,
that
I'm going to try to get around
we warned you that if you bailed out the Wall Street banks to the tune of $30 trillion, you'd have these kinds of shortages in entitlements.
If I could, let me just take an economic issue. I wasn't going to take this because it was the economy, but would you mind if I answered that? Okay. You would mind?
That's another subject.
That's the problem. That's why we can't
Could I circle back to that after or take a couple of healthcare questions?
That's the reason that we can't
here's what I'm going to do
afford
with
things.
acceptable. Since the majority is here for healthcare, I promise you to circle back to that. Is that acceptable?
This is healthcare.